Morning, everyone. Today, let's discuss about hemangioma. Hemangioma is a vascular lesion. It is the most common benign tumor of infancy. So, hemangioma as a word is derived from Greek words hema, which means blood, angio means vessels, and oma meaning tumor. So, hemangioma is characterized by rapid endothelial cell proliferation and a gradual involution phase. Hemangioma does not appear during birth. It appears up to 8 weeks of birth, it starts appearing, and it will gradually involute and disappear completely over a period of time. So, what is the reason for development of hemangioma? Hemangioma develops as a result of derangement in angiogenesis, which leads to exuberant proliferation of vascular elements due to any imbalance between angiogenic and angiostatic forces. So, as I had already told, hemangioma is a vascular lesion. So, vascular lesions can be further classified as vascular tumors and vascular malformations. So, hemangioma comes under the category of vascular tumors. So, vascular malformations are any arterial malformations, capillary malformations, or any lymphatic malformations. All these things will come under vascular malformations. So coming to hemangioma, again hemangioma can be divided into two categories, that is infantile hemangioma and congenital hemangioma. Infantile hemangioma is the most common type, that is it develops after 8 weeks of birth. So it is not present during birth. In case of congenital hemangioma, which is a rarer form, the lesion is present during birth. So at birth, the lesion is completely developed. So there is no rapid growth phase after the prenatal period. And the complete growth has already happened during birth. And it can even be seen in prenatal ultrasonography. So yeah, this is how hemangioma will appear. So, hemangiomas can be further classified as capillary hemangiomas and cavernous hemangiomas based on the vascularization system. Capillary hemangiomas consist of small capillary bodies which is organized globularly, and cavernous hemangioma consists of wider vessels which can reach to a very large size. Hemangiomas, when it is present on the papillary dermis, it has got a bright red color and it is called as superficial hemangioma. When the hemangioma is present on the reticular dermis or the subcutaneous tissue, it is called as deep hemangioma, and this will appear as a bluish color. So compound hemangioma is when both the components, that is capillary and cavernous components, are present, then it is called as compound hemangioma. So coming to the life cycle of hemangioma, that is hemangioma, there is a proliferating phase, that is up to 0 to 1 years of age. It starts proliferating. Once it appears, there is a gradual, there is a rapid growth. There is a rapid growth phase which happens during 0 to 1 year of age. Then after that, there is an involuting phase, that is 1 to 5 years of age, where the lesion will start involuting. That is, there is a decrease in the lesion noted. Then after that, there is an involuted phase where the lesion completely disappears. That is over the period of 5 years of age, the lesion will completely disappear. Now let's see the clinical features. Clinical features, as I had already told, it is the most common tumor in infancy. It is seen in 5 to 10% of the 1-year-old children. It shows a female predilection with 3:1 ratio. And head and neck region is one of the most common region where hemangiomas appears. That is over 60% of the cases it is seen in head and neck region. In hemangiomas usually doesn't appear as multiple lesions. Usually it is seen as a singular lesion. Over 80% of the cases are single lesions. So this is one of the hemangioma case on palate. You can see the pigmentation. So when there is a superficial tumor of skin, it can appear as a raised bosselated bright red color lesion, which is also called as strawberry hemangioma. And on palpation, it will be firm and rubbery in consistency. In deeper tumor, it will be only slightly raised and a bluish hue will be there. So, fully developed hemangiomas, it is usually not present during birth, but still during birth, there can be evidence of small thread-like telangiectasia or small pink macules can be seen during birth, where the lesions will develop later. So during few weeks of life, the tumor will demonstrate rapid development that occurs in a faster pace compared to the development of the infant. Compared to the overall growth of the infant, the development of the lesion will be very fast. So proliferatory phase usually lasts up to 6 to 10 months of age, after which the tumor slowly decrease in the size and begins to involute by itself. So the color of the lesion will gradually turn to dull purple hue, and the lesion will be less firmer on palpation. So by the age of 5, most of the lesions will completely regress, and 90% of the cases it will resolve completely by 9 years of age. So after the tumor regression, in 50% of the cases, the skin will be completely as normal. But in 40% of the cases, there might be some permanent damages, such as some wrinkling or some discolorations can be seen, scarring. Any such discolorations can be seen in 40% of the cases. So there can be numbness and tenderness or paresthesia can even be seen. In 20% of the hemangioma, there are chances of complications. The most frequent one is ulcerations, and even hemangiomas, when it does occur in the crucial areas, it can be associated with significant morbidity. So patients with multiple hemangiomas or large facial hemangiomas are also at high risk for concomitant visceral hemangioma. So whenever we are seeing a hemangioma cases, we should suspect about visceral hemangioma and central hemangioma as well, which we'll discuss later on. So tumors in the neck and laryngeal region can lead to even airway obstructions. So yeah, coming to intrabony hemangioma or central hemangioma. So this is one of the very important thing which we should be aware, that is hemangiomas can be present in either maxilla or mandible as a central lesion. That is the lesions might be seen in intrabony. That is it can be detected most often in 10 to 20 years of age and more seen in females compared to males. Lesion will be completely asymptomatic. So in such cases, we might not be able to diagnose it in the initial stage. So the lesion might be completely asymptomatic, but we can see the radiographic evidences. So patient might not have any kind of symptoms such as pain or swelling in an initial phase. But there can be mobility of teeth or bleeding from the gingival sulcus, and a bruit or pulsation may be seen on auscultation or palpation in such areas. So again, the radiographic appearance, mostly it is seen as a multilocular lesion. There can be soap bubble or honeycomb-like appearance seen in radiograph, but mostly these radiographic features are variable. So even it can be multilocular showing soap bubble appearance. It can be showing smaller loculations where it can be seen as a honeycomb appearance. It can even be seen as a small radiolucent area which might mimic a cyst or any periapical infections. So yeah, extraction of such teeth can lead to bleeding emergencies. So aspiration of an intrabony hemangioma can yield copious amount of blood, and in such cases, we should be very cautious. So even in radiograph, even sunburst radiographic pattern can also be seen in hemangioma. So in this OPG, we can clearly see in the right ramus region, we can see multilocular radiolucency, which is suggestive of hemangioma. So another form is it can also be seen as coarse linear trabecules that appear to radiate from approximate center of the lesions. The central hemangioma will show resorption of the roots of involved teeth. It can also show calcifications, which can be seen as radio opaque rings. So this is another occlusal radiograph showing the mandible, where again you can see a well-defined lesion with a sclerotic border, and you can see bony spicules within the lesion. This is another occlusal radiograph in mandible. Again, in anterior region, you can see soap bubble appearance, that is proper multilocular radiolucency is seen, which shows a soap bubble appearance. Coming to differential diagnosis can involve vascular lesions, trapezoosarcoma, angiosarcoma. pyogenic granuloma, epulis, or squamous cell carcinoma. Coming to investigations, that is angiography can be done in case of hemangioma, where you can even make out the feeding vessels. Uh, but the definitive diagnosis will be only with biopsy. If if biopsy is required, we should always go for fine needle aspiration first before any kind of biopsy, because there is a tendency for bleeding. So that's why. So, and other investing modalities will include CT and MRI. Whenever we are suspecting any central lesions, whenever we are suspecting any intra-body hemangiomas, we can go for CT and MRI to know the exact location and extent of the lesion. This is a CT image. Here you can see clearly in the left side, you can see multilocular radiolucency. This is another image you can where you can see in the right side, you can see in the ramus region, multilocular radiolucency is seen. This is a color Doppler ultrasonography image, again where you can see moderate lesion showing vascularity. Another thing we should be aware of is syndromes associated with hemangioma. So, whenever you're seeing hemangioma cases, you should also rule out these syndromes, which include Rendu-Osler-Weber syndrome, Stooge-Weber syndrome, Kasabag-Merit syndrome, Maffucci syndrome, and Klippert-Giannoni-Weber syndrome. So, all these syndromes also we should know so that we can rule out these syndromes whenever we are seeing any case of hemangioma. Coming to the treatment, um, as it regress by itself, as it will involute completely by itself, treatment is usually not required. Watchful neglect is usually done, but the parent should be educated regarding the lesion. The parent should be educated regarding the rapid growth phase which can happen. So all these things should be conveyed to the patient. And if treatment is required, these are the treatment modalities which are used. That is, surgery is the first option. Second is laser surgery. Laser surgery can be done using argon or carbon dioxide lasers. Cryotherapy can be done using carbon dioxide snow. Again, corticosteroids can be done to decrease the angiogenic cytokines. If it is not responding to corticosteroids, you can try interferon alpha. Another thing is propranolol, and then sclerosing agents you can try to thrombose the vessels. So these are the treatment modalities. Thank you.